Hey everybody, Holly Watkins with the Arc of North Carolina. I am here today with Christy Myers, which is really exciting because I don't get to see her very often. Christy is the Director of Integrated Health here at the Arc of North Carolina. Hi, Christy.
Hi, how are you, Holly?
Good, good. Before we jump in talking today, we're going to talk today about the winter viruses. I wanted to give you an opportunity to talk a little bit about yourself.
Absolutely. Thank you, first of all, for having me today. It's exciting. I'm one of those old timers. I've been around for a while. I graduated with a bachelor in arts in English back in 1992, and then decided to go to nursing school, which I went to Watts School of Nursing, where I graduated with a diploma and a registered nursing degree. So I was a very lucky one because our school did tours at our state developmental centers. And as soon as I went and did that tour, I knew that was exactly where I wanted to work. And there I did for 17 years. So I worked at our Central State Developmental Center for 17 years, as I said, and in many roles from clinical to administrative. Prior to coming to the ARC, it's been over a couple of years ago, I also worked as a nurse consultant with one of our state LME MCOs, now Taylor Plans, as well as one of our community autism providers. So my passion is integrated care for people with intellectual and developmental disabilities.
That's really wonderful, and we're so lucky to have you here on staff.
Thank you.
So, as I said, Christy, I wanted us to talk a little bit today about winter viruses. You know, patients are reporting that these viruses are really strong. It's taking longer to recover. We're seeing an increase in hospital stays, an increase in emergency room visits for respiratory viruses. So, I wanted to talk more about viruses, and let's start with the viruses that are being reported the most. Can you tell us what those viruses are?
Sure, Holly. I just, as of this week, we've still got flu that is probably rising the most, and it is um, expected to probably peak around mid to late February. So I think we'll continue to see that rise for a bit. COVID week before last had gone down a bit. I was hoping we were going to continue on that downward trend, but it looks like this past week it spiked up just a little bit. And I think we'll see some variability as it continues to hopefully decline. We are still seeing some RSV cases, or respiratory syncytial virus, that is, we're seeing in our hospitals. And it's so hard because virus symptoms are all very similar. So getting tested, trying to figure out what exactly the virus is that a person may have is important. But yeah, that's what we're really seeing mostly. We're seeing a lot of pertussis, so what we call whooping cough, that seems to have declined as of recently since the end of 2024. Still all four of those respiratory viruses out there, and monitoring them weekly to see if they're headed up or down or where we go from here.
So I'm going to put you on the spot a bit. If I'm at home and I'm feeling sick, I have a cough, runny nose, I'm sneezing, maybe I have a fever, and I just don't feel great. Am I going to know, oh, I have RSV or I have the flu, or am I going to be able to tell a difference, or do I have to go to a doctor to be diagnosed and get treatment?
Absolutely. It's a great question, Holly. COVID, the flu, RSV, all cause very similar symptoms, like congestion and runny nose. I will say COVID and the flu are more likely to cause a fever or higher fever, body aches and headaches. But your symptoms can help point toward a diagnosis, but it's really impossible to tell which virus you have based on just symptoms alone. There are some very minor differences when it comes to RSV. Typically, people may not have a fever or even either a very low fever. With that, what you see mostly with RSV is cough, runny nose, and stuffiness. Those are the three major symptoms that you're going to see, along with wheezing, because it's inflammation of those tiny airways in the lungs. So wheezing sounds are very prominent. Flu and COVID are much more difficult to be able to tell apart. Just very subtle differences, such as flu, typically you won't see as much of a sore throat that you do with COVID. With flu, you typically have more of a runny nose and stuffiness than you do with COVID. But again, they are so similar that there's no way to really know without having testing done by your provider.
So then it sounds like one of the best pieces of advice may be just to consult with your doctor, with your primary care provider, and talk with them about what the best course of action might be.
That is exactly right. And it is really good to get tested and find out exactly what you have. And in particular for high risk groups, because there are times when antivirals might be appropriate. And so we want to make sure that, people who are at high risk are getting any sort of adjunct treatments that may help them outside of the typical treatment for flu and COVID, as well as RSV.
Okay. And you know what? It's as if these respiratory viruses aren't bad enough, we're seeing a rise in norovirus, or more commonly known, the stomach flu. What are some of the symptoms of norovirus?
Absolutely. Yes. We have seen a lot of norovirus, and there has been, of course, a very recent surge. And unlike COVID, RSV, and the flu, there is not a vaccine to prevent someone from getting norovirus. And also another thing to mention regarding norovirus is that hand sanitizer does not work very well against it. So we'll talk more about that. That good hand washing with warm soap and water is so important. When it comes to the symptoms of norovirus, also known as the stomach flu, typically you're going to see nausea and vomiting, diarrhea, stomach cramps. Sometimes you might see a fever, usually low grade, could have a headache or some body aches, but the biggest nausea, vomiting, diarrhea, stomach cramps are the main symptoms that you're going to see with that. And this typically going to last for 1 to 3 days for most people. So it's a tough one, and it's really going around right now.
Yeah. So what can we do to help protect ourselves from these viruses that are going around?
Absolutely. Well, of course, always, vaccination is important for our respiratory viruses. All of them, flu, COVID, and RSV, all have vaccinations. So, talking to your provider about what's best for you, that's a really important one. We want to continue, like I said, with that really good hand washing, warm soapy water. We want to limit, being in really large crowds, also covering our nose and mouth if we're sneezing or coughing, remembering that these germs get on surfaces. And so really keeping those surfaces clean when we have somebody sick. And I'll be honest with you, I think one of the most important things is staying home when you're sick. That is a great way to protect other people and from the spread of illness. And because all of these are very contagious, they spread very quickly.
Right, absolutely. And, all of those are good tips. And, I want to make sure we do talk about the fact that people with intellectual and developmental disabilities may be at an increased risk for complications that could be really bad from one of these viruses. Can you talk a little bit about that?
Yes, absolutely. I think it's so important, to talk with your doctor about what is best for you, deciding what's best for you and your family, making sure you're making informed choices. And I think another thing to remember is to think about your local pharmacist. Oftentimes they're much more accessible. They have amazing information. They can probably spend more time sitting down with you talking about vaccinations and what you would need to consider. But I think people being able to make informed choices when it comes to vaccinations is so important.
So this is all really good information, Christy. Is there anything else you wanted to add? Anything else that we should know?
I think, staying in touch, making sure we're monitoring where things are, taking those precautions that we talked about, um, reaching out to trusted sources for good information. Um, I think, hopefully we're going to see these winter viruses start trending down soon. And then we'll have to be ready for them the next time they pop up.
Yeah, yeah, absolutely. So I think that's all the information we've got today on winter viruses. Christy, thank you so much for joining us. I really appreciate it. Appreciate your expertise.
Thank you, Holly. Appreciate being here today.
So that's it today for everybody. Make sure you keep coming back to our YouTube channel and to our social media. And you can always go to our website, www.arcnc.org.